Hello and welcome to Pregnancy Info. Today we will discuss all about the hygiene and take care of female after delivery. Recovery and care after delivery. The postpartum period refers to the first 6 weeks after childbirth. This is a joyous time, but it's also a period of adjustment and healing for mother. During these weeks, you will bond with your baby and you'll have a post-delivery checkup with your doctor. Adjusting to motherhood. Adjusting to everyday life after the birth of a baby has its challenges. Especially if you are a new mother, although it's important to care for your baby, you also have to take care of yourself. Most new mothers don't return to work at least the first 6 weeks after birth. This allows time to adapt and develop a new normal. Since a baby has to be fed and changed often, you may experience sleeplessness nights. It can be frustrating and tiresome. The good news is that you will eventually fall into a routine. In the meantime, here's what you can do for your easier transition. Get plenty of rest. Get as much sleep as possible to cope with tiredness and fatigue. Your baby may wake up every 2 to 3 hours for feeding. To make sure you are getting enough rest, sleep when your baby sleeps. Seek help. Don't hesitate to accept help from family and friends during the postpartum period as well as after this period. Your baby needs to heal and practical help around the home can help you get much needed rest. Friends or family can prepare meals, run errands, or help care of your children in the home. Eat healthy meals. Maintain a healthy diet to promote healing. Increase your intake of whole grains, vegetables, fruits, and proteins. You should also increase your fluid intake, especially if you are breastfeeding. Exercise. Your doctor will let you know when it's okay to exercise. The activity should not be strenuous. Try taking a walk near your house. The change of scenery is refreshing and can increase your energy level. Functioning as a new family unit. A new baby is an adjustment for the entire family and can change the dynamic you have with your partner. During the postpartum period, you and your partner may also spend less quality time together, which can be troublesome. This is an overwhelming and stressful period, but there are ways to manage. It's normal to have the baby blues during the postpartum period. This typically happens a few days after giving birth and can last for up to 2 weeks. In most cases, you won't be experiencing symptoms all the time and your symptoms will vary. About 70 to 80% of new mothers experience mood swings or negative feelings after giving birth. Baby blues are caused by hormonal changes and symptoms may include unexplained crying, irritability, insomnia, sadness, mood changes, and restlessness. Coping with your body changes. Along with emotional changes, you will experience body changes after giving birth, such as weight gain. Weight loss doesn't happen overnight, so be patient. Once your doctor says it's okay to exercise, begin with moderate activity, a few minutes a day, and gradually increase the length and intensity of your workouts. Go for a walk, swim, or join an aerobic class. Vaginal discharge. It is typically 2 or 4 weeks after giving birth. This is how your body eliminates blood and tissues from your uterus. Wear sanitary napkins until the discharge stops. Don't use tampons or DOTch until your 4 to 6 week postpartum appointment or until your doctor approves it. Pelvic floor changes. The area between your rectum and vagina is known as the perineum. It stretches and often tears during birth. Sometimes a doctor will cut this area to help your labor. You can help this area recover after your delivery by doing Kegal exercises, icing the area with cold packs wrapped in towel, and sitting on a pillow. Sweating. Hormonal changes can cause nighttime sweating after having a baby. Removal blankets from your bed to stay cool. Uterine pain. A shrinking uterus after giving birth can cause cramping. The pain subsides in time. Ask your doctor after about safe pain medicines. Breast engorgement. Your breast will fill with milk a couple of days after birth. This is a normal process, but the swelling or engorgement can be uncomfortable. Engorgement improves with time. To ease discomfort, apply a warm or cold compresses to your breast. Sore nipples from breastfeeding usually disappears as your body adjusts. Use nipple cream to smooth cracking and pain. Constipation. Eat high-fiber foods to stimulate bowel activity and drink plenty of water. Ask your doctor about safe medicines. When should you see a doctor? The baby blues are different from postpartum depression. Postpartum depression occurs when symptoms last for more than 2 weeks. Additionally, symptoms may include feeling of guilt and worthlessness, a loss of interest in daily activities. Some women with postpartum depression withdraw from their family, have no interest in their babies, and have thoughts of hurting their babies. So, this is the case when you need help of your doctor. Outlook. Giving birth can change your family unit and routine, but you will eventually adjust. Any emotional and physical changes you experience after birth will slowly improve. Don't hesitate to talk to your doctor about any concerns, whether it's related to depression, your baby, or the healing process. Vaginal healing. For the first 6 weeks or after the birth, your uterus slows its lining, causing a vaginal discharge called lochia. At first, it is like a heavy bleeding, gradually decreases to a light discharge. Plain maxi pads are best, says midwife Kathy Wilson of Thames Valley Midwives in London on. She advises against products with deodorants or special outer layers which can irritate or even impede healing. Tampons are a no-no. Perineal care. If you had a tear or episiotomy during the birth, you will have stitches that can be uncomfortable while they heal. Even without stitches, the area around your vagina, the perineum, may feel bruised and swollen. To speed healing and ease discomfort, keep the area clean with plain soap and water during your regular bath or shower. In the first few days, an ice pack can help reduce swelling. Allow air to circulate by going without a pad for an hour or so each day. Use all towels to protect your bleeding while you lie down for a rest. Use a plastic squeeze bottle to gently squirt the perineum with warm water so you urinate. Even a tiny tear may sting when urine touches it. Do Kegal exercises, lightening and releasing the vaginal muscles to speed healing by increasing the flow of blood to the perineum. Herbal Bath. Midwife Kathy Wilson suggests an herbal bath to speed healing. Buy a pre-packaged mix of postpartum bath herbs or DIY your own in advance. You will need equal parts dried calendula flowers, chamomile, chickweeds, and plantain leaves. Steep in boiling water for 20 to 30 minutes. Add this tea to a warm bath with half a cup of sea salt and a cheesecloth bag containing crushed garlic. Care for your C-section scar. Gently clean your C-section incision with soap and water once a day. Dry with a clean towel, then apply antibiotic ointment. Talk to your doctor about whether it's better to cover the wound or leave it open to air out. Avoid carrying most things beside your baby and hold off on vigorous exercise until you get the okay from your doctor. Ease aches and pains. If you are achy from pushing, take acetaminophen. Ease overall achiness with hot showers or heating pad, or even treat yourself to a massage. Stay regular. Your first postpartum bowel movement can take time, but don't force things. Eat plenty of fiber-rich food, whole grains, fruits, veggies. Go for a walk and use gentle stool softener to get and stay regular. Avoid straining, which isn't good for perineal tears or your C-section scar. Hope I have explained all about the hygiene and take care of yourself after delivery. If you like the video, then share it, like it, and also subscribe my channel. Thank you.